Hello. The Mental Capacity Act is a really important law for people with a learning disability. It applies to anyone who is 16 years and older who may lack the ability to make particular decisions for themselves. According to the Act, every adult is assumed to have the ability to make their own decisions wherever possible. This includes adults with any form of intellectual or physical disability. A capacity decision depends on the situation. For example, someone might be able to decide if they want a cup of tea or coffee, but they may be unable to make complex decisions about a change of medication. The Mental Capacity Act is also important to ensure that anyone who is unable to make decisions on their own gets the support they need to make those decisions. Healthcare professionals should follow the 5 principles of the Mental Capacity Act. 1. Always assume the patient has the ability to make a decision until you know otherwise. 2. Do everything possible to enable the patient to make their own decision. 3. Do not assume the patient cannot make a decision just because you don't agree with them. For example, if somebody does not want to wear a coat when it's raining. 4. Sometimes people might find a decision too big or too complicated to make by themselves. These could be health or social issues. In these situations, the patient should be supported by making a decision that is in their best interest. This should be made along with the people who know them best, such as family or support workers. 5. If a decision has to be made in the person's best interest, it should be time and situation specific. Treatment and care provided to someone who lacks capacity should be the least restrictive of their basic rights and freedoms. You may need to make reasonable adjustments, such as offering a longer appointment time or easy-read information. If it is a particularly difficult decision, such as moving house, social prescribers or the Community Learning Disabilities team might be able to help. Some people with long-term reduced mental capacity may have a lasting power of attorney or similar in place. If you have any concerns about the decisions that have been made, talk to your local safeguarding team and advocacy team. Recently, there have been changes to the way some services are accessed, such as online video consultations. This enables patients to access safe remote appointments where necessary. A risk assessment must be carried out to see if a remote appointment is suitable for the patient. You should consider reasonable adjustments, such as who should be present for the consultation. Even if patients are not seen face-to-face, they are still protected by the same laws, including the Mental Capacity Act. This is a brief overview of how the Mental Capacity Act applies to people with a learning disability. If you need advice or support, talk to your local learning disability team.